let's go to visual diagnosis, inspection. The topic is tongue coating, part 2. Let's look at the observation and significance of the tongue coating. When it is thin, white, rooted, normal moistness, that is normal coating. When it is rootless coating, that is stomach qi deficiency or yin deficiency. White, thin, and slippery coating is damp cold disrupting wei qi. If it's white, thick, and slippery, that is internal damp cold, food stagnation of short duration. Thick and white is food stagnation or excess cold. For dry and white coating, that's cold that is in the process of transforming into heat and fluids are being injured. If it is greasy and white, it's internal dampness or external cold or dampness and spleen yang deficiency. When it is dry and yellow, its internal heat is starting to damage yin. For thin and yellow coating, that is wind heat. Thick and yellow is food stagnation turning into heat and excess heat. For greasy and yellow is internal damp heat or phlegm heat. Yellow stripes on the side of the tongue and the rest of the coating is white, is exterior pathogen invading inwards and heat in the stomach and intestines. If the coat is dark yellow stripes on the sides of the tongue and the rest of the coating is yellow, that is heat in the liver and gallbladder. It's yellow on one side and white on the other, that is heat in the liver and gallbladder and Shaoyang syndrome. If it's damp, gray, black, or brown, it is cold damp. If it's dry, gray, black, or brown, it's extreme heat. If it's moldy, it is stomach fire or toxic fire. When there's no coating, that's yin deficiency. For dry tongue, that's heat, blood deficiency, or yin deficiency. For wet tongue, that's yang deficiency or cold. The tongue coating reflects the state of the yang organs and in particular the stomach. It reflects the conditions of heat or cold and fullness or deficiency. A normal tongue should have a thin white coating. The tongue coating is formed from some residual dirty dampness, which is left over from the stomach's digestion and reaches the tongue upwards. Thus, a thin white coating indicates that the stomach is digesting food properly. The coating gives an indication of the presence or absence of a pathogenic factor and of its strength. A thick coating always indicates the presence of a pathogenic factor, and the thicker the coating, the stronger the pathogenic factor. Such a pathogenic factor may be exterior or interior, such as exterior wind, dampness, cold, retention of food, phlegm, heat, and fire. A coating without root looks as if the coating had been added to the tongue rather than growing out of it. This indicates deficiency of stomach qi. The partial absence of coating indicates deficiency of stomach yin. The total absence of coating indicates deficiency of stomach yin and or kidney yin. If the tongue is also red all over, it is a definite indication of deficient kidney yin with empty heat. The pathological coating colors can be white, yellow, gray, or black. Here in these pictures, we can see on the first one, the stomach crack and rootless coating. On the second, it's partially peeled, and on the third, it's completely peeled. A white coating indicates a cold pattern, unless, of course, it is thin and white, in which case it is normal. A yellow coating indicates a full heat pattern. A gray and black coating can indicate either extreme cold or extreme heat, according to whether the tongue is wet or dry. Let's look at the tongue coating as a summary. It reflects the state of the yang organs and in particular the stomach. It reflects conditions of the heat, cold, and fullness deficiency. Normal coating is thin and white. Thick coating is pathogenic factor. The thicker the coating, the stronger the pathogenic factor. The absence of coating is stomach yin deficiency. Total absence of coating with red tongue body is stomach and kidney yin deficiency with empty heat. A white coating is cold pattern. Yellow coating is full heat pattern. Gray and black coating is extreme cold or extreme heat, and the tongue is wet or dry, respectively. Thank you for your attention.